Hello everyone from my messy car. I love when I have a guest. I just want to throw that out there, handing the camera to somebody else and being like, share with us your story or what you know that you can teach us. So today's video was such a girl chat, although we did talk about the guys too. But one of my friends is a top fertility doctor, and we talked about all the things. We talked about getting pregnant, we talked about endocrine disruptors, we talked about plastic, we talked about supplements that she like really believes in, and we talked about diet and lifestyle and food. We talked about all the things. And so if you're interested in starting a family, we cover that. If you're wanting to start a family maybe in the next few years, we talk about that as well. We talk about different options. We talk about all the things. So we're gonna go upstairs right now and chat with my friend. I've reached the winded stage of pregnancy. I'm so winded carrying my tripod, my giant glass water, my bag. Here we go, it's my first time here.
Welcome to Sabo Fertility, the waiting room obviously, and then this is our front desk with Shayla, our incredible medical assistant. So this is our procedure room, and so patients come in, they have the beach up top.
No way, that's so fun.
And then they have the TV so they can watch their procedures as we're doing them.
I saw on Instagram you have a meditation room.
Yes.
And I think that's special.
Relaxation room, so really important, some great crystals, good energy, salt lamp. And we have like playlists for meditation.
I like that.
Yeah, just really wanting patients to de-stress and lower the vibe.
I'm here with Dr. Sweldo, which is really funny calling you that because we're mom friends and our kids are best friends. And our topics are usually like mom topics and school and like how we can, you know, better ourselves with that. But today we get to talk about like girl things, like girl talk. So tell us who you are and who you help.
Yeah, so I'm Dr. Sweldo. I'm the founder of Sabo Fertility Center here in Fort Lauderdale, and we really believe in fertility care reimagined. So we help anyone who's on their journey to build their family.
Would you say that you add like more holistic things that maybe some other fertility doctors don't? Okay,
yes.
Great.
So we have this word woo-woo.
And I say that on my channel all the time. So I peeped the crystals. When I saw crystals, I was like a little bit of woo-woo.
So I'm very traditionally trained. And so when I finished my training and really first started, it was very classic, like very black and white, like all about, you know, the traditional medicine. And really, it was my patients who kind of opened me up to these different things, and I started doing the research and really realized like how much all this stuff really impacted a patient's chance for success and becoming pregnant.
That brings me to my first question. Do you think that infertility is on the rise now because of endocrine disruptors? I'm thinking like BPAs and PCOS, or do you think that we're just better at diagnosing it, or a mixable?
So I think it's actually a combination of both.
Okay.
So I think it's a few things. Number one is it's a lot less taboo now, and I'm grateful to reality TV for this because so many celebrities have been really open with their journeys, and before it was something that there was a lot of shame around infertility, and so now we're able to really bring it up to the light. It's dinner table conversation, so it's just a lot more talked about, so more patients are seeking out resources.
Okay.
Plus, post-industrial revolution, we are living in an environment with more toxins than ever before in our human history. So it's natural to think that we would have more infertility.
Yeah, and I'm glad that you can like say that as a doctor, because I feel like doctors are always like, well, it's in the literature, but I was actually reading that it takes like 17 years for new literature to come out.
It's really slow because we want to make sure that the studies are done right. So you're always going to see like the disclaimer at the end, like more research is needed. But there was actually some really great data that was just presented at the last ASRM, which is the American Society of Reproductive meeting. So it's an international gathering that happens every October, talking about microplastics and how we now have confirmation that microplastics are present in male sperm.
Yep.
And they've actually seen it in the placenta.
Yep, and so that is why I drink from glass. Not Valley like needs to sponsor me ASAP, but yeah, for me that's like, I feel like it can get a little toxic when you start thinking of everything because it's like so many things.
Yes.
But we also do have to admit, because I feel like there's a lot of people that don't want to admit like that they're doing something wrong.
Sure.
Because plastic water bottles and kids containers, it's like easy and it's convenient. But we also have to say, like with easy and convenient, there's going to be a downside to something.
For sure. So, you know, what I tell my patients, so your family building journey is a marathon, right? Like for those who are infertility, they're going to be taking a little longer. But even if you don't have infertility, if you're planning to have more than one child, like that's still a multi-year process, right? So you want to do things that you can do in the long term that are sustainable and make those small changes. So changing out glass for plastic water bottles, or changing out, you know, stainless steel or whatnot for the containers.
So when you have a client coming in or patient coming in and they are experiencing infertility, do you put them on a program with that besides, like, I know you do IVF and medication, but do you also say, oh, in the home you should switch up?
I love that question. Thank you for asking me that. So whenever I talk about treatment, we always talk about, okay, what is the actual medical treatment you're going to be doing with me in the office? That's sort of one arm to our approach. And then lifestyle and nutrition. And then we do a whole inventory in terms of like, how's your sleep? How's your stress? What's your work like? You know, what are the things outside? What do you do to love your body with movement? What do you do to nutrient your body with, you know, et cetera, like all that stuff. And then we talk about integrative practices as the third arm. So integrative practices, think of things like supplements, acupuncture, meditation, herbs. So all that sort of encompasses integrative practices.
Do you think that we're seeing more PCOS, or again, we're just better at diagnosing it? Because I was also reading that endocrine disruptors are making more women have PCOS.
So I think it's a combination of things, right? So we know that PCOS is poorly understood. We're a little better at it, but it's poorly understood. And so I think we're getting better, or we're getting more uniform in how we're talking about PCOS and what is PCOS. So that is, from the doctor side, it's becoming more uniform, the criteria. And then on the patient side, I think like, oh, I'm skipping periods, or I'm really hairy, or whatever symptom is not normal, and maybe I should see, maybe I should see a doctor for this. So I think it's a combination of like patients are seeking it out more, recognizing it's not normal, and then the medical field sort of unifying what they're talking about.
Can you just break down what is PCOS, just like quick for somebody that doesn't know?
So PCOS stands for polycystic ovarian syndrome. And it's a misnomer because it's not actually cysts on the ovary. It's actually an egg excess disease. So the ovary normally is the size of a golf ball. If you have an enlarged PCOS ovary, which is one of the symptoms, then you may have something that looks more like an apple or a grapefruit. So just to give kind of that visual distinction. But that's not the only thing. So because it's a syndrome, it's really a constellation of signs and symptoms. So you want to address each patient individually, and you want to understand what are they presenting with. Do they meet enough of the criteria to make that diagnosis?
Somebody has severe PCOS and they want to, you know, have a baby ASAP.
Yeah. So I want to just mention one thing, because if you Google PCOS, like the typical picture is sort of someone who's heavier set, someone who's very hairy, maybe they have darkening of the skin folds around the neck or in the arms. And that is one type of PCOS. But back in 2012, the NIH actually describes 4 types of PCOS. And so you can actually have type A, which is that classic presentation, B, C, and D. And like you could have regular cycles and still have PCOS. You could have, you know, no hair and or no acne and still have PCOS.
That's what I have insulin resistance. Like I gained weight in the midsection. And if I'm eating, like there was one month that I was having a ton of hot chocolate in New York City and I didn't get my period that month. And it's like, well, totally there has to be some Right. So I think that's a really important thing, is if you Google like PCOS because you're thinking you might have it, what you find online may not be you, but you still may have it. So understanding that there's different presentations. So that's my segue to your question about getting pregnant ASAP. So for the first time, at least that I'm familiar, a professional society talks about supplements, specifically inositols. Which I love. I love the brand Ovasitol. Do you know that brand?
So that's actually the brand I use. So I'm a huge fan of Theralogics, and this is not sponsored, but
we wish.
But Ovasitol is great. It has both myo-inositol and D-chiroinositol. And over the long term. So, and that's what with supplements or any sort of integrative practice, you have to understand that it's long term. Right. You can't just take it one day and expect a magic fix.
Yeah, there's nothing like that.
But Ovasitol has been great for my patients with PCOS. So in the long term, I've seen really great results with it. Some of them return of menses on their own. And then even if they do need me and they need a little bit of treatment, they tend to have a better response to treatment.
It's just incredible. And it's not something that we're, like my gyno didn't tell me about Ovasitol. I found it on TikTok from some girl. And she was like, try it. I tried it. And I was like, okay. Can you walk us through the fertile window? Because growing up, I thought you could just get pregnant anytime. And it was all about prevention. You know, like you're in high school, you're like, I don't want to get pregnant, or college, you're like, I don't want to get pregnant. And now it's time to get pregnant.
Yeah, so like my pipe dream, my like 20-year pipe dream is I want to change that conversation. And I really want to make it about reproductive education instead of just pregnancy prevention.
Right.
Which is like all they talk
right.
about.
And if you understand the fertile window, then you can use that as birth control, even for somebody that is married with kids. Maybe you don't want to have any more kids, or you don't want them right now. And you don't want to be on birth control. I know I don't want to be on birth control, but like if you understand your fertile window, you can prevent and conceive.
Yeah. Talking about the fertile window. So if you look at any textbook, open up, you know, Grey's Anatomy or whatever, you will see that 28-day cycle is considered the norm. Really, that's plus minus a week. So really 21 days all the way to 35 is considered normal. The key there is consistency. So if you have a consistent, regular 21, 22-day cycle, that would be considered normal.
Okay.
Or 32, 33-day cycle. Now, if you're like 21 days, 1 month, 34 the next, that's not normal. That you definitely want to check out. But consistency within that 21 to 35-day window is considered normal. And then what we know is that post-ovulation, that corpus luteum lives for about 2 weeks, so about 14 days. So basically, you want to track your cycle length and then minus 14 days, and that's going to give you ovulation. So for example, if you have a consistent 35-day cycle, actually, you don't ovulate day 14. Actually, you're ovulating closer to day 21.
That's when I ovulate.
Oh my God, really?
Yeah,
day 21. So the idea is understanding your body. If you have regular cycles, understanding what that cycle length is. And by the way, I actually just had this conversation with someone this morning, is the first day of your cycle is the first day of full flow. So for those ladies who may have spotting for a day or two beforehand, that's not considered day 1. So first day of full flow is your cycle day 1, and then you want to track cycle day 1 to your next cycle day 1. And over 2 or 3 months, you'll get kind of that cycle length that we're talking about. So it's about a 36-hour window. So basically, for those who are trying to get pregnant, I have them test with ovulation strips, and I have them check in the morning, first urine of the morning, because it's the most concentrated. And so anticipate you're going to get a positive. If you're a 28-day cycle, it'll happen around day 14-ish, right? So 28 minus 14. And you want to have intercourse the day of the positive and the day after. And the reason for that is because the urine kit is catching that hormone, that LH surge. Either it's on the way up or it's on the way down, right? So LH surge start to finish is 36 hours. So that window is about 36 hours.
What if so I personally don't use ovulation strips. I like cervical mucus because I read it in Taking Charge of Your Fertility. I read that book a long time ago, but
So I definitely look for that as well. You know, for those who are trying to conceive and maybe having difficulties, some things are going to be easier than others. So like I have patients who really love their BBTs, their basal body temperature. Others who love cervical mucus. For me, the strip, it's kind of easy. You just pee, you're done. But cervical mucus, if you're willing to check it and you're open to that, it's actually very like obvious. So it goes from like this thick kind of boogery. I don't know what that word is. It's like this very thin, stringy.
Mine just comes on my, like, I don't have to do anything, not to be TMI, but this is for the ladies to be watching, so men, like, leave right now. But, like, I'll wipe, and it'll be slippery, and I'm like, so when we didn't want another, I was like, well, I gotta avoid this day, because it's, like, super slippery, and I remember that's how I got pregnant with Violet, when I saw it was slippery, and I was like, let's just try.
Yeah. And there you go.
There we go.
There we are.
But, yeah, I found, like, I read people were doing, temperature tracking. I think with the Oura Ring that's easier, but I feel like that would be the most, I think that would be a little much to do every day. It definitely gets tedious, and I think the longer you've been trying, like the harder it gets to do all the things. And so I would say pick the one that's the easiest, the most convenient for you, that you're the most comfortable with, and just stick with that. Now I want to jump into supplements. I want to jump into lifestyle, workouts, and diet. Beautiful. I'm so happy. And I have CoQ10 because I had my husband on CoQ10, and because he wouldn't give up alcohol when we were trying to conceive both times. And not that he's like drinking a lot, but he'll drink like 2 after work, like 2 beers or a glass of wine or whatever. And I was like, oh, it's not really, everyone says to give it up, but he wouldn't. And so I read CoQ10's good.
Yeah. So I actually recommend CoQ10.
Okay.
So here's, like, let's start at baseline, because I have, as a physician, I do have to say, like, what the guidelines say. And the guidelines say that everyone should be on a prenatal vitamin with at least 400 micrograms of folic acid every day.
Okay.
So that's like the minimum that everyone
so even before you're pregnant.
Right.
Okay.
So even before you're pregnant, if you're thinking about trying, you want to have that on board for about a month or so before.
Okay.
And it's really just like to replenish those stores of vitamins and minerals before you conceive.
Okay, so you want to start with the prenatal. So I didn't do that, but my husband does drink athletic greens every day.
Okay, there you go.
So that's like for a man.
His version.
Yeah, his version, but for me, I didn't, but I do eat healthy.
Yeah. So then that's what's recommended by the guidelines, right?
Okay.
Then it's going to be a little bit different for everybody. So I personally like to recommend baby aspirin 81 milligrams, and it's over the counter. The thought there is that it has anti-inflammatory properties, so in theory could like improve receptivity by the body. And then it also has blood thinning properties, so potentially enhances blood flow to the uterus.
Is this kind of the Mucinex hack?
So, I mean, listen, we all have our like, again, woo-woo, right? So I don't have great data to back it up, but in my view, it's sort of low cost, low risk, so why not? And then I always tell patients, if you're having easy bruising or anything, just stop it. It's fine.
Okay.
So baby aspirin's one, and then vitamin D is another one I love to talk about, because most of us are deficient. Even though we live in South Florida, we actually spend most of our time indoors.
Right.
Especially in the summertime.
Yeah.
Vitamin D is definitely one that I highly recommend. And, you know, the dosing is going to be variable, but anywhere from 2,000 units daily to 5,000 units daily. Some of your fertility specialists will actually check vitamin D levels, because there's been some studies relating it to reproduction. And then once you get outside of that, you start to tailor in on what's the patient's diagnosis. So, for example, PCOS, we mentioned the inositols. There's a few other ones that I love for PCOS, so things to consider if you have insulin resistance. Berberine is a really big one. Sawgrass, root palmetto. So things like that. I think it's really important to understand each patient's individual case. CoQ10 is an antioxidant I love, and actually the company that makes Ovasitol, they have a CoQ10 version. And there's a few other companies out there that are reputable. I would talk to your doctor about it. You know, it's a multi-billion-dollar industry.
I know,
there's
that's
a lot.
Scary. Yeah.
It's very overwhelming. Like, you go on Google and there's 25 different brands. So definitely talk to your provider, and you want a provider that's comfortable talking to you about supplements, right?
I feel like they're not. Like, I remember when I was balancing my hormones, I told my gyno I was doing acupuncture, and he was like, well, that's not going to do anything for you. Okay,
so I actually love acupuncture.
Me too.
I'm a believer. And there's some really phenomenal acupuncturists here in the South Florida area. But again, that was one of those where my patients actually told me about it. This was now 6-7 years ago. And I went for low back pain. And it was the only thing that made it better. And I was like, okay, I'm a believer. Like, I got it. And so from then on, and I can't tell you how many stories I have of patients doing acupuncture. Now, remember, acupuncturists can be board certified and can be specialty trained, just like physicians. So you want to look for someone who's specializing in women's health, who knows about the reproductive hormones and the cycles and all of that. But yeah, I'm a huge fan of acupuncture.
Yeah, I think if you, on one end, can say trust the science, this has been around forever, acupuncture's been around forever. So
thousands of years.
Yeah, with the, I don't know, people will talk on one end and be like, well, I trust this vaccine or IVF or whatever because it's been around for so long, but acupuncture has as well. So I just feel like it sometimes the woo-woo stuff doesn't really get the
validity.
Yeah.
For sure. And actually, in some countries in Asia, the hospitals incorporate acupuncture as part of the treatment plan.
Wow.
So, yeah, because it's been around so long and it's so well studied in their cultures.
Okay.
So yeah, I'm a huge fan, huge believer. And I agree. And I think a lot of times we rely on the hard science. And don't get me wrong, like, fertility treatment is amazing. IVF is nothing short of a miracle, like what we're able to do in the lab. But I think it's not either or. Like, I think it's, how can I get my patient success? And it's all of these things, right?
Well, and I want to ask her about nutrition and diet, but just jumping to IVF really quick. Yeah. All of my friends that have done it, and me and Jared know a lot of people that have done it, it's worked for all of them. Like, I don't know a single person that it hasn't worked for.
Yeah.
And that's not to say that it won't someday work for somebody, but that just goes to show that there is, like, they wouldn't have their kids if it wasn't for IVF. So there's just, like, a place for both.
Yeah, absolutely.
But maybe their IVF journey was successful because they were also doing acupuncture or also taking CoQ10.
The combination, for sure.
Yeah, so is there, like, a fertility diet that women should be on, even if they're not trying to conceive now, but they're like, this was a question, like, I'm in my 20s, but I know I want to have kids in, like, 2 or 3 years.
Yeah. What you do now is going to impact later.
Right.
And we know that, and we know that some of the changes are reversible, but patterns over time, right? And you don't want to, like, be changing your habits when you're ready to start trying. Like, you want to incorporate that into your lifestyle. One, because it's just good for you, like, long term, but then two, because it's going to optimize you for success. This was like the late 90s, early 2000s. There was this, you know, very trendy, the fertility diet and all this stuff. What we understand now is that it's probably some version of the Mediterranean diet. Okay. So it's really a focus on unprocessed foods. And when you think, so like anti-inflammatory is super trendy right now. Yeah. Really what that is like unprocessed, not packaged, right? So like eating whole foods, eating lean protein, fresh produce, all of that is going to really enhance just your overall health, but specifically your reproductive health. And the really restrictive diets are actually not good. So we want good fats. We want like the avocados, the nuts, like, you know, fresh eggs, all like that all has to be a part of a well-balanced diet for sure. Yeah. And do you think that there's any relationship with liver? I think there's a lot of like iron related stuff because we're so anemic towards the end of pregnancy and then after postpartum and whatnot. So I think it's a lot around that. And when you conceive, a lot of, like, I'm always, I run low on iron. Not in an unhealthy way, but I'm always like a little bit lower. Yeah. So I definitely think overall, like if you can just focus on Mediterranean diet, unprocessed foods, you're probably doing the right thing. Okay. And then depending on your diagnosis, there may be additional things. So like if you have endometriosis, for example, you really want to focus on anti-inflammatory. So no caffeine, no alcohol, like anything that's going to potentially flare your pain symptoms. Okay. If you have PCOS, you really want to focus on the lean protein. Protein is like your favorite friend when you have PCOS. Yeah, I get my period every single month when I'm eating protein and eating good. And I think back to Christmas time last year, I didn't get a period at all because I was having so many like sugar and carbs not and sugar. And carbs and sugar. That was what I ate. And like I don't know, I think it's funny people won't admit that. They're like, yeah, but there's got to be more to it. And it's like, but we weren't supposed to eat that like that. Yeah. And honestly, a lot of my PCOS patients are not eating enough calories because they struggle with that weight, so they're being really restrictive. And they're definitely not eating enough protein, like almost 100% of them. Have you ever tracked your protein? So I'm ashamed, like, do as I say, not as I do, like, it's really bad. It's hard, because I did with my husband before, because he's all about protein. He's really big on men's testosterone's lower now than it's ever been. Do you agree with that? There's actually, like, national data showing sperm counts are going down. Yeah, so that's what he always talks about. He heard it on a podcast, and then he got into, like, you know, upping his protein, but we, like, tracked it, and I was like, severely under, like everyone talks, at least get this amount. It's like if you don't start your morning with a protein shake or eggs or something, like you're not even gonna I'm like eating a meatball on the way here. But I do think if you actually, because a lot of times we're just go like, I'm already doing all the things, but if you actually sit and inventory like what you put in your mouth in a 24-hour period, very, very little of that is actually protein. Yeah, so my holistic practitioner, I've been working with her since I was like 25 years old. She's big on like, nobody needs one of those Starbucks drinks because she hates caffeine already. She knows I won't give it up. But she's like, you have the caffeine, then mixed with like a mocha macchiato. She's like, what are you doing to your insides? Like for her, that's like where she starts number one with everybody. Like, do you go to Starbucks and get one of those like sugary? Because she's like, not only are you giving it your insulin a spike, then you're giving the caffeine a spike. And then you're crashing from all of that. So then you're compensating by eating more calories. Right, more carbs. So at baseline for everyone, we probably are not consuming enough protein. But if you have PCOS, it's like the threshold is even higher. Okay. And then when you're doing your exercise, so again, it's one of those, if you actually inventory, like, I'm active. I did sports growing up. I've always been, but like if you actually inventory what you do in a week, most of us are way under like what's considered. And in fact, if you track your steps and you do less than 5,000 steps a day, you were considered sedentary.
My husband literally just told me this.
Before cars existed, before like we were walking everywhere. In a lot of European cities that are smaller, more condensed, the populations are much denser, you're able to walk everywhere. Here, it's like we get in our car, we go to school, we get in our car, we go to work, we get in our car, we go to the restaurant. And that's the other thing. I've talked to a lot of physicians who are now focusing on lifestyle, and they're like, in America, all of our gatherings are around food. So like you go to happy hour, or you go to brunch, or you whatever. Like
Halloween,
you know.
we just celebrated Halloween. I'm like, we went to a trunk or treat together. I really appreciated some of the trunk or treats that they literally gave our kids a book. Yes. Our kids were like,
yeah, but it's true. Like, yeah,
what's wrong with that?
Or a craft, or like a small project. So I think really, really taking stock and just being honest with yourself, right? And then the last piece I'll add when it comes to lifestyle and nutrition is accountability. Most of us,
I like that.
Yeah, most of us as educated adults, we know what we need to do, but it's actually implementing the things that are going to get us to where we need to go, right? So like for me, I knew that exercise had to be a part of my journey, but until I actually had a trainer come to my home or come to my place of work, like exercise wasn't happening. Right. And so I was like, okay, I've already paid for this. She's already come from 20, 30 minutes away or wherever. Like I can't cancel on her last minute. And so I would end up and that's honestly in my adult, like where I am this stage of life, that for me has been the only way I've been able to be consistent with physical exercise.
Yeah, I would rather spend money on that or a workout class, because workout classes aren't cheap either, but I'd rather spend money on that than like going out for dinner or like clubbing, or not that we're in that stage, but like people do spend a lot of money going out, happy hour.
Yep.
Drinks $20. You could literally go to a $20 workout class. Okay, so now she's gonna answer the questions you guys asked on my Instagram. The first is, when should someone come see someone like you?
Ooh, I love that question. So if you're going textbook, it's under 35.
Okay.
Heterosexual relationship.
Okay.
And having sex for at least a year without conceiving.
Okay.
If you're over 35, then that gets shortened to 6 months.
Oh, okay.
That said, if you have irregular cycles or a known risk factor for infertility, if you've had an STD in the past or pelvic surgery, or your husband has had some sort of impact or injury to the testicle, or frankly, you're just anxious, like I would schedule a consultation. I think a lot of people, exactly. I think a lot of people think fertility specialist means IVF, and that couldn't be further from the truth. Like,
especially with our conversation, she has a meditation room. She's talking about like health and wellness. Yeah.
In fact, today I just literally did a pregnancy ultrasound for a couple who came to me because they didn't want to do IVF. And so our focus was, I was like, look, this is a marathon. It's going to be a few months together. And here we are.
Yeah, I love that. Yeah. Okay, this is more of a fun question, but is there some truth to conceiving a boy or a girl? Like if you conceive before ovulation, it's a boy. If you conceive on ovulation, it's a girl.
So this is probably one of the more common questions I get, and I wish that I could say yes.
Okay.
But the answer is no. So in fact, in the West Coast, there was a big university. They'd come out with this system that could spin sperm and find the boys, and then the predictive value was 50%.
Right. What can men do to improve their sperm?
Oh my God, I love this question. So honestly, what I see often, I won't say all the time, but often, is that the woman is doing all the things: supplements, acupuncture, nutrition, buying the glass containers, etc. And then the guy's over here vaping every day. Or something. I'm not even joking. Like literally, like okay. So all the things that we're talking about today, they also apply for your man. So taking inventory, what's his lifestyle, what's his nutrition, what's his sleep, what's his stress, and then what are his like potential exposures. So we talked about alcohol, we talked about caffeine, we talked about tobacco, but for example, my long distance truck drivers, my firefighters, construction or paint workers, like,
because they're staying up late?
No, because the toxin exposures.
Oh, okay.
So like, what does your guy do for work that could potentially be impacting his fertility? And then the number one thing, especially here in South Florida, if you are trying to get pregnant, do not let your man take testosterone. Okay. I feel like so many guys are prescribed testosterone and they take it not understanding that it's going to turn off sperm production in the testicle.
The next one is, a lot of people ask about conceiving over 35. and even into their early 40s. I saw some questions, is it healthy? And then some, it's like, well, they are already 35. What are their options?
Yeah, so I love this question, and we could honestly do like a full video just on this question. So I'm going to try and give you guys like the highlight reel. Basically, if you're over 35, it is considered a high-risk pregnancy because the likelihood of having pregnancy complications starts to increase. Now, nothing magical happens on your birthday, right? Like, because that's the other thing. But understanding that there is going to be a slight increase, the older you are, there's going to be a slight increase for pregnancy complications. But again, patients who are coming to me generally are very highly motivated. And if you're into sort of a more holistic approach to your fertility journey, you're probably already healthier in general. Like you're probably already taking better care of yourself than somebody else compared to your age. And so that risk may not be the same.
Like we were talking, the kids were playing outside, and we were just talking about how like Giselle is pregnant at 44, and I read her book, and she really is so healthy. Of course, we don't know like if she did anything to get pregnant or if it was just natural, but that's somebody that's like super healthy and pregnant at
100%. So is it possible? Absolutely yes. That's probably the bulk of people that I see in my office. I think like the flip side to that is that even though the 40s are the new 30s, the ovarian aging is still real, and the science, it's almost there. We're doing a lot of cutting edge stuff, but we haven't quite been able to reverse the ovarian aging process. So if you are over 35 and you're having some difficulty, please, please, please don't wait and go see a doctor and talk about it, because you probably may need a little help earlier rather than later.
Okay, this person asked, number one tip, and it can't be a prenatal tip, for conceiving.
Number one tip.
And it can only be one thing. It could be a supplement, it could be a lifestyle.
I mean, I think the biggest tip would be like take charge of your health.
Yeah.
And so that's kind of all encompassing, right? Because it's like, one, you have to be your own advocate. Because I can't tell you how many women are 37, 38, oh, you're fine, just keep trying, and then they come to me at 40, right? And then like those
and you
2
had
or 3
wished that
years,
you just saw
exactly,
them
it made a huge difference. Take charge of your health also means lifestyle, nutrition, supplements, like all the things that we're talking about. And then take charge of your health also, like understanding your body and understanding what you're open to, right? Like I have patients who are not open to IVF, or I have patients who are not open to something called third party, like using a surrogate or something, right? So like, because it's all stuff we've never talked about before. Like growing up, it was all pregnancy prevention. So now when someone starts talking about you may need help, you may need treatment, you may need this, you may need that, like our brains totally are like, what?
Okay, and then the last question is all about egg freezing, which you actually talked about on your Instagram. You did it.
Yes.
So didn't use it.
I haven't had to use it, thank goodness, but I'm so glad that I did it. So I always tell people I have never had a patient regret freezing their eggs. I've only had patients regret that they didn't freeze their eggs. And the technology has actually not been around that long. So ASRM removed the designation of experimental only in 2012.
Okay.
So I think it's a beautiful option. You know, we talk about egg freezing when a patient is like, look, I know I want children. I don't want them right now.
Yeah.
And so what can I do? Like, what are the options available to me? And egg freezing is one of those. So again, it's one of those, you know, seeing a fertility specialist means you have to freeze your eggs. No. Seeing a fertility specialist means you're going to get educated about it. Maybe you check your egg reserve, see how many eggs you have, and see whether you're a good candidate for it. Have the conversation on the risks, the benefits, right? It's not going to be a one-size-fits-all.
And that you can't improve, right? You can't improve the amount of, you're born with the amount of eggs. Because I saw a few other questions, how can we improve our egg quality? But
so a lot of the egg quality piece is going to be around the lifestyle, the nutrition, the supplements. There's a lot of work being done in the supplement world, and sort of the like the biohackers and the anti-aging. There's a lot of experimental stuff out there, some of which I'm doing here in my own office, but none of it is like ready for prime time. None of it is considered standard of care. And so yes, absolutely, the current paradigm is we are born with the eggs we have, and we lose them as we get older.
Right, just standard. There's this influencer, Danielle Bernstein, and she got out of a relationship and froze her eggs. I believe she's in her late 20s or maybe early 30s. But that's the only person I've ever seen talk about it. And she was like, I don't have somebody right now, and I know I want to be a mom.
Yeah, and I just wish more people talked about it. And again, like, it's not for everyone, but I think educating yourself and knowing it's an option, because I have never ever seen anybody regret doing it. I've only seen people who are like, I wish I would have known about it. I wish someone would have encouraged me, like, to do it sooner.
Yeah, and I think also too, when we see like celebrities getting pregnant in their 50s or something, you don't know that they didn't use eggs from their 20s.
Yeah, for sure.
Yeah. Thank you for chatting with us.
This was so fun.
I'm gonna have all her contact info down below if you do want to book an appointment or something.
Yeah, sure. And then I also have like a few videos on my blog, on the website for Sabo. So there's like some additional stuff on PCOS there, fertility testing, so they can go and look on that if they want.
Okay,